getting better yet. Let's bring in Dr. Annalee Baker, an emergency physician at a hospital in North Miami and a telemedicine physician on staff at NYU. Dr. Baker, thank you very much for being here.
Thank you for having me.
Let's start with the status where you are. What are you seeing and experiencing?
Well, we are seeing surging cases like nothing we've seen before. Lots and lots of patients coming in sick with COVID-19. It's a little bit different than the first peak we saw a few months ago. You know, back in April, most of our patients were older. Now we're seeing much more younger patients, many of whom have no underlying condition to suggest that they would have been at risk to become very ill with this virus. The patients we're talking to, some of them are able to tell us where they picked up the virus. They may know who the sick contact was or know where they were, but many are telling us they have no idea, which is suggesting that asymptomatic transmission really does play a role. That's concerning to us. You know, also, apart from all of the patients with COVID-19, we are seeing the downstream effects of something we call medical distancing. Patients early on were told by us to stay home, to avoid the hospital at all costs, unless it was an absolute emergency. And in some ways, we were almost too successful in getting that message out. Many people avoided and delayed care for other conditions. And so we're seeing that now. These patients are coming in sicker than they would have been. And in some cases, it's affecting the outcome, which is really a tragedy within a tragedy.
South Florida, you know, we've been talking a lot about your area, not only because of the spread, but because there are, you know, restrictions and policies in place now, particularly in Miami-Dade, that are more restrictive than the rest of the state on movement, on gatherings, this mask penalty, for instance. But a virus, we know, doesn't respect city, county, state borders. Do you worry that without broader state restrictions, without a mask mandate that's broader either for the state or for the country, things won't improve where you are?
I do. Yeah. You know, I think we're finally reaching a point where the messaging on masking is consistent, and that's a good thing. Certainly masks and social distancing save lives. But unfortunately, that only goes so far. So when you're in a position where community transmission is low, individual efforts like masking, distancing, hygiene are really pretty effective at keeping control of the virus. But when you're seeing surging cases like we're seeing now in South Florida, unfortunately, it takes a little bit more than that. And, you know, I think when we opened in May, when we reopened, whether it was subconsciously or not, people just got more lax about wearing masks. People started thinking maybe it's okay to go to a gathering, maybe even visit grandma. I haven't seen anyone in a few weeks and I'm not sick. And unfortunately, we're now seeing a few weeks after that the effects of all of that. And I do think that we are beyond the point where individual actions are going to be enough to stop this surge. We really need a concerted effort and a strong effort from our leaders in order to get control of this. None of us would like to see another lockdown, but if we don't slow things down pretty quickly and pretty dramatically, we're going to have no other choice.
Yeah, and it's so easy with something invisible, especially when you're in an uncomfortable position, when you're staying at home all the time, and so many of the things you're used to, those comforts of daily life, have been changed to sort of let your guard down and go back to what you knew. But like you say, you know, we have to keep telling people, and we need people like you to keep telling us that these are the real consequences if we do let our guard down. You have a really unique perspective on this because in addition to working in North Miami, you also do telemedicine in New York City. You see both cities and how they've each dealt with this. Dr. Birx today just described hotbeds in your state in Florida, Texas, and California as 3 New Yorks. Are we really just seeing a repeat? I mean, you mentioned that things have changed in South Florida from the beginning to now, but are we seeing a repeat of what we saw in New York, or are things in South Florida and Texas and California different?
That's an interesting question. I do think New York was unique in many ways. You know, as the very first epicenter within the United States, New York was sort of in uncharted territory. We didn't know very much about the virus. We didn't know exactly what would work and what wouldn't work, and how the city and state should respond to such a crisis. So it's a little different now. We find ourselves in a similar surge in South Florida, but it's a few months later. We know a lot more about the virus. And we have the benefit of being able to look back at what was done in other places, such as New York, to see what worked, see what's translatable to us down here. However, there are some significant differences between Florida and New York, between Florida and Arizona and Texas, for that matter. We have a different culture, different population density, different lifestyle here in Florida. And so some of the things that we're encountering are things that maybe were not challenges in New York, things like opening beaches. And on top of all of that, it's occurring at a different time of year. We're in the middle of summer, so kids have to get ready to go back to school. That's at top of mind for parents and educators, and certainly for our local leaders. So that is presenting new challenges as well. It was a little easier in the spring to shut down and tell everybody, this will be temporary. Got to homeschool your kids, to do virtual learning for a couple of months. But I think all of us in the back of our minds thought, or at least hoped, that this would be over by now, or that we would have control of things. And unfortunately, here in South Florida, we're just seeing quite the opposite. We're experiencing what New York experienced, but at a much more difficult time in terms of what we have to face as a society. Adding to that, how devastated our economy is, I think is just making it very challenging to find consensus between leaders and the public. And for that reason, I think one of the most important things that we're trying to do is just build an alliance between healthcare workers and the public, and to understand that we can work together despite whatever political arguments are going on or whatever different measures are being done in different places. We have the ability to control some of this, and we certainly have the ability to impact the outcome.
Yeah. As we talk about these numbers, 12,000 new cases reported yesterday, more than 400,000 cumulative in Florida. And you talk about the overwhelming sense in the hospitals, and I'm sure you and your colleagues starting to feel the fatigue of this, or felt it long ago. What are the immediate stopgap solutions? I mean, it's going to be weeks, if not months, of hard work to get to a point where hospitals aren't overwhelmed, and where, kind of mitigation that New York has seen. In the meantime, we talk about the thousands of additional nurses coming to areas of the state of Florida. Is that going to help? Are we going to have to talk about field hospitals? I mean, what can be done in the short term?
Well, that is absolutely going to help. And you're correct in saying that one of the biggest challenges we face is staffing shortages. A lot is made about hospital capacity, and we hear these numbers and we try to make sense of them. But remember that capacity is not just an open bed. Those beds require a tremendous amount of staff, PPE, resources to actually make that bed reflective of capacity. So in terms of immediate stopgap measures, absolutely bringing in more staff is something that we're working on both at a hospital level and as a state. We're sort of approaching this problem from multiple angles. Our leaders have worked on getting us more remdesivir and some of these therapeutics, increasing our supply so that we can treat the patients that are coming in critically ill. Also, as a hospital and as individual physicians and nurses, we're doing things like reallocating the staff that we do have in order to preserve the capacity that we have as of now, so that we don't lose any more than we absolutely have to. We're trying to limit the number of people that go into each patient room. We really changed our workflow. I work in a teaching hospital, so a lot of that involves a patient being seen by a medical student and a resident, and finally by an attending physician like me, by a nurse, by registration. I mean, the list goes on and on in terms of the number of people that it takes to take care of a patient in the hospital. So with this unique virus, and certainly with the pressures of PPE shortages, we're changing the way that we do these things. So we're trying to consolidate the number of people to the absolute minimum that need to be there to take care of the patient. And also even simple things like asking a nurse to, for example, give a medication or draw a blood test or whatever the case may be. I try as a physician to consolidate those orders so that the nurse doesn't have to don PPE and go in multiple times. Because remember that every single person that goes into that room every single time requires a whole nother set of PPE. So that's been a challenge, but something that I think we are doing much better than we were a few months ago in terms of how we use the resources we have. We're also partnering with nonprofits. I just got a great shipment of N95 masks from Third Wave volunteers in New York, which we very much appreciate. We're getting a tremendous outpouring from the community. We've gotten homemade face shields and all kinds of things donated. And of course, we don't want to rely on donations alone. Hospitals doing a lot to procure things on their end as well. But we do fear what's going to happen in the coming weeks if we don't see these cases start to taper off.
Yeah, yeah. Well, we're watching it very closely, and Dr. Annalee Baker, I appreciate the work that you're doing. All of our best to you and your colleagues, and thank you very much for taking some time to paint the picture for us on the ground there in South Florida.
Thank you so much.
We've got some new news this hour. The Department of Justice has announced that federal charges are being filed against 18 people stemming from protests